So we'll get started here. If there's a few more trickling in, we can watch as we go. For anyone who doesn't know Dr. Dan yet, this is him down here. He's going to be talking all things jaw today, so we'll see how that goes. If you have any questions, feel free to drop them in the Q&A at the bottom of the chat. You can kind of hold them to the end if that's okay. Just makes it a little bit easier and kind of monitor them as we go. Welcome, Dr. Dan.
All set?
Whenever you're ready.
Awesome. All right. So hi, everyone, and thanks for joining us on this Monday evening where we're going to talk about jaw and jaw pain. So like Dr. Jill said, my name is Dr. Dan, and of course in the background we have Dr. Jill, so she's going to be running the webinar a little bit in the background. So if something goes wrong, it's her fault, not me. So between her and I, we're the two chiropractors in Kawartha Care Wellness Center right now. So if you come in for chiropractic care, you'll probably see one of us. There's also a third chiropractor at Kawartha Care, Dr. Manju. She's the clinic owner, and she's actually off right now with the newborn. Some of you may know that. But yeah, so she's probably in the background watching. So if she's here, hi Manju, and if not, when she watches this, hi Manju. All right, so let's get going. So we're going to talk about jaw pain today. So we're going to focus on the jaw. All right, so just wanted to add a little piece before we begin. Some things that I'm not going to be talking about. So we're not going to be talking today about teeth and gums. We're not going to be talking about tongue or salivary glands. We're not going to be talking about gingivitis and cavities, all that kind of stuff that you go see a dental hygienist or a dentist for. We'll save that for them. I'm not going to focus on that. But as a chiropractor, we're specialists, among other things, in joints. So we do other stuff, but we basically treat every single joint in the body. And of course, the jaw, because it moves, it requires a joint, as a joint. So anytime there's anything wrong with that, we treat it. And so we're going to look at that today. So jaw joint, it's kind of a mouthful to say that. So I'm going to be calling it the TMJ, which stands for temporomandibular joint. So in case you didn't know that, that's what the jaw joint is actually called. So anytime you hear me say TMJ, I'm just referring to the jaw joint. So the first thing I want to do is I want you guys to do an exercise with me, and you're going to actually have to see me. So if you just look up to where I am, I want to go through an exercise where we actually feel our jaw joint. All right. So what we're going to do, and take both fingers, and you're going to put them just on the side, on either side of you, on your cheek, just in front of your ear hole. So my hair is a little bit in the way, but you can see I'm in front of the ear hole there. And you're going to push in pretty firm, kind of like you're feeling for the doneness of a steak, just fairly firm. And then 3 times, very slowly and as wide as you can, I want you to open and close your mouth. All right, here we go. 1, 2, and 3. Good. So if you're in the right spot and you're pushing hard enough, what you would have felt is as you open your jaw really wide, you'd feel your fingers actually fall in, okay? And so as you do that, you're actually feeling inside the TMJ joint, all right? And then as you close, of course, they're pushed back out. So that's where your jaw joint is. So anytime we talk about jaw joint pain or TMJ pain, we're talking about this area kind of right in front of the ears, all right? So how does it move? So Jill, are you able to see my mouse here as I move around?
Yeah.
Awesome. Okay, so over here, as we open our mouth and close our mouth, just casually as we talk, the joint right here, this is the TMJ joint, and it just moves to allow us to open and close our mouth. Now, if you look on the picture on the right, as we open our mouth really wide to the very end ranges of how far our mouth opens, the joint actually, it dislocates in order for us to be able to fully open the mouth. Now, that sounds dangerous and bad, of course, dislocation. That's not something that you typically want from a joint. But in this case, the body actually, it purposely does this so it can give us a little extra range so we can open our mouths a little bit more, take in more food, talk louder, yell, whatever it is that you need to do with a wide mouth, all right? And so it's the only joint in the body that dislocates during normal, regular use. But in order for the body to do that, a lot of complicated things need to happen in the soft tissues. And because of that, very often things go wrong. And so that's why it's pretty common for people to have some sort of TMJ problem or a jaw pain, anything like that. Okay, so TMJ disorder. So that's essentially some other words for it. You may have heard TMJ disorder. You may have heard TMJ dysfunction or TMJ syndrome, and some people even just call it TMJ. Now, that's not the right word for it, but they all kind of refer to the same thing. And what they're referring to is anytime that joint has some sort of issue that causes you problems, where it's not functioning properly. So this happens in about 5 to 12% of the population. So if you think of 10 of your friends, one of them probably has this. And if you're on the webinar, the problem, you might actually have it. You might be here to figure out what's going on. So you might be that 1 in 10 person. So there's 3 major regions or parts that can kind of go wrong in TMJ disorder. The first one is the joint itself. So the joint and anything within it, it can have some sort of problem. That can happen on both sides, or it can happen only one side or only the other side, but the joint in general can have an issue. Another problem can be from the muscles. So the muscle that controls the joint might have some sort of issue. And the last one is the nerve that controls the muscle that controls the joint. So all of these encompass just general movement of the joint and problems that can go wrong with it. So it's actually our job, Jill and myself, to figure out which part is having an issue, and then we try to treat that specific piece. So for you guys at home, here are the things that you actually want to look for to figure out if you've got some sort of TMJ dysfunction, all right? So the first one is clicking. Now, clicking on its own isn't so concerning, but typically it's clicking along with some other symptoms. That's what you want to really look for and decide if you want to come in and get some sort of treatment to try and fix the problem. Now, if you have like really bad, obvious, terrible clicking, it might be worthwhile just getting looked at to see if it's an issue. But if it's just some quiet little bit of clicking and that's it, it might not be too much of a problem just yet. And that clicking can happen as you open your mouth and as you close your mouth. So it can go in both directions or both. Some other things you want to look for is pain. Like we said, pain in the jaw joint, in the TMJ, right in front of the ear, especially if that pain gets worse with a lot of drinking, chewing, or a lot of talking. Other things we look for pain-wise is pain in the morning. So that's typically if you're at nighttime, if you're a teeth grinder, if you grind your teeth while you're sleeping, you might notice that you wake up with more pain because you've been using that joint all night unbeknownst to you. And that's something that we, of course, look for. We're going to check out the teeth and see how ground down and polished they might look. And another one you might notice is pain after prolonged sitting or standing or prolonged posture for a long time. And typically that's if you have some form of bad prolonged posture. So if your maybe head is jutted out or you're sitting at the computer, you're hunched over, you're really stressed, you're starting to use all the muscles in the neck and the back of the neck and the head, and that all kind of comes up and can impact how the jaw works and how the jaw functions, and that can lead to pain as well. So if you're noticing any jaw pain in general, but especially if there's certain things that bring it on, and if there's clicking as well, definitely worth coming in, getting looked at, seeing if we can potentially help. Some other problems you might run into: difficulty opening or closing your mouth, or an even scarier one is lockjaw. So if your mouth locks closed or maybe locks open. So if that happens, that can be a pretty scary experience, especially if you don't know what's going on. The most important thing to do if that happens is don't panic, don't freak out, don't try to force it closed or force it open. Just wait a little while, massage the jaw a little bit. We'll talk about some treatments you can do and see if it kind of releases itself. If it doesn't, absolutely come in and see us. There are lots of options that we have to try and fix this problem for you. And definitely get in sooner rather than later if you can for something like this. And then some other symptoms that you might come across, especially the TMJ being right in the head and impacting the muscles. It can lead to some headaches from the jaw joint. And then because the TMJ is so close to the ear, you might also experience some dizziness, some vertigo, or some ringing in the ear. So these last two, they're a little less common, but they definitely can happen. But the most common presentation that I see is clicking with a little bit of pain, and pretty commonly I see a lot of headaches connected to that. Fortunately, I've only so far seen one lockjaw. All right. So, of course, it's 2021 and we have to talk about masks. Masks are mandatory everywhere you go right now. And so we've actually seen an increase in incidence of TMJ dysfunction because of mask wearing. And so there's a few theories as to why this is happening, or at least these are my theories. The first one is, of course, it's uncomfortable. You've got some extra forces, maybe those ear loops that are just tugging on your ears, causing a little pain in the area. I also have a patient who she doesn't like the sensation of a mask on her face. And so as she's walking around day to day with her mask, she'll actually jut her jaw out and try to push the mask off of her face. And so when you're using the muscles like that, you're putting forces in a strange way through that joint. Of course, it's probably going to lead to some TMJ issues. And then the other one, of course, we've got that mask in front there. So we got to talk a little louder, maybe some plexiglass or some other barriers in the way of talking to someone. So you're raising your voice, you're yelling a little bit more. And so you're just putting some more forces through that joint. Of course, that's going to predispose you to potentially having some more incidents of jaw pain, clicking, or TMJ dysfunction in general. All right, so let's say you've got some clicking, you've got some pain, you want to look into it a little bit more before you come in and see us. Totally all right. Here are some things that you want to do at home just to check out your jaw and see how it's working and how it's moving. So the first one is you go to the mirror and you want to bite down and look at your teeth and see them line up. And then slowly open and close your mouth as wide as you can. And you want to see that jaw go in a straight line, okay? Now there's a whole bunch of other things that it can do. Sometimes I've seen it just go off to one side or the other side. I've seen the C pattern where it kind of comes and over and comes back, or maybe this way and back. I've also seen an S curve where it kind of zigzags on its way down and then zigzags on its way up. So anytime the jaw is not opening straight down and straight up, potentially that's a TMJ dysfunction that you want to look at. The other one, I've written 3-finger test, also known as the 3-knuckle test, okay? So the average person should be able to take 3 knuckles, if you look at me here, and they should be able to fit it in like this. Basically biting on the 3 knuckles. So if you want to try that at home, you can go for it. If you can't quite fit in 3, it's okay. If you have some pain and you can't quite fit in 3, maybe come get it looked at. If you're struggling to fit in 2, there is very likely something wrong, and we'd love to check it out and see if we can help you. The last one is the popsicle stick test. So I don't actually have a popsicle stick, but I do have a tongue depressor, which is, I think, the same. Going to work the same in this case. If you don't have either of those, you can just grab a pen or something like that. So what you want to do, if you're experiencing some jaw pain, let's say it's on the right side here. First thing you're going to do is clench down and bite hard. Okay, and feel that. That's probably going to increase some of your pain. So you just want to bite down, see if that increases your pain. And then the next step you're going to do is you're actually going to take the popsicle stick on the same side that you're having pain. You're going to bite on it. All right, or pen, whatever you have, just bite on it. And you're going to see if that either increases the pain, keeps the pain the same, or in some cases, it actually makes the pain go away. Now, interestingly, if this makes the pain go away, what that tells us is there's probably something wrong right in the joint. That actually means that there's an issue if the pain goes away when you bite on the popsicle stick. If the pain doesn't go away, what that potentially means is that it's actually an issue with the muscle, and that might be something that you can either work on a little bit yourself or go for massage for it. So we're going to talk about treatments next. All right, so treatments. So let's say you have some TMJ problems, maybe some clicking and some pain. You've come in and we've assessed you and we've determined, yes, it seems and appears that you do have some TMJ dysfunction. What do we do for it? All right, so here in the clinic, some of the things we do, the first one is we're going to work on some stretches just to relax those muscles, loosen them up a little bit. We're going to go through the stretches on the next slide, but there are 3 general stretches that we do, or 3 movements rather. In some cases, and not all, I recommend that you chew some sugar-free gum. Sugar-free just for the dental aspect of it, because we don't want to put some cavities in there while we're treating you at the same time. That's for our dental hygienists and our dentists out there. But yeah, so in some cases, we do recommend that you chew some sugar-free gum, but the key is not all cases, and it's on a case-by-case basis. It kind of depends on exactly what the problem is. So that's something that you'd want to get figured out before you just start self-treating. So don't just chew gum because you think it's going to make it better. It might actually make it worse. Some other things we do are some facial muscle release therapy. All that means is a face massage, essentially. Just a little bit of a variation. So we go in there, we find those muscles that are causing you some problems. We give you a bit of massage. We actually get your help with it. We get you moving around while we're doing those massages. And that seems to work pretty well. The next one is we use a little bit of, or at least I use a little bit of acupuncture. And I find this to be very helpful. In fact, I would say of all the treatments that I offer, acupuncture is the most powerful for TMJ dysfunction. It gets rid of most of the problems most of my patients have when it comes to TMJ dysfunction. We're not going to go into the actual like cellular and chemical level as to how and why acupuncture works. I love talking about that. So anytime you want to come by and hear about it, I am all for that. But just for time's sake today, we're not going to do that today. The next thing we do is potentially some adjustments into the joint. So chiropractors, I'm sure many of you may know that we adjust joints in the spine, but some of you may not know that we actually adjust every joint in the body. If you can point at it and moves around, we can adjust it. That's our specialty. So TMJ is no exception to this. There are jaw adjustments that we do as needed. And then the last one, I put this one at the very end here, intraoral vibration therapy. All that means is I take a glove, put it on my hand, I go into the mouth, and I give a bit of a massage to the muscles on the inside of your cheek. And then what I do on top of that is I actually take a massage gun and I put it on my hand, so my fingers become a massage gun. And I just gently massage those muscles. Now, there's a reason I've put this one at the very end. It's a very common therapy that's used, but it's not the most comfortable therapy. And so I kind of resort to it as a last ditch effort. It's not the worst thing in the world. And especially if you have jaw pain and headaches and they're bothering you day after day, sometimes this is definitely the route to go. But I typically leave it till the end if at all possible. So those are the treatments that the majority of the treatments that we use in clinic when we come across any TMJ dysfunction. So here are some things that you can do at home if you've just got some mild TMJ pains and dysfunction, just some basic stuff and this is what I send pretty much all of my TMJ dysfunction patients home with. So the first one is stretches, all right? So the jaw can do 3 movements and each movement has 2 directions. So we're gonna go through them. The first one, obvious, open and close, right? So pretty simple, open and close. And then the next one, the jaw can go left and right. Right? And then the last one, the jaw can actually jut out and it can protrude back, forward and back. So in clinic, we'll do some of those. We'll help with the stretches, especially as a chiropractor, we can get in there and you can just kind of relax and we do them for you. But typically I send a lot of my patients home with some of these stretches as well. And then the last one, patients typically really enjoy this. They go home and they give themselves a self-facial massage. And there's 2 specific areas that we really like to focus on as we're doing this. So if you want to follow along, especially if you're having a little bit of jaw pain, this might be a nice thing to go through with you. So the first thing we're going to do, we're going to take 2 fingers. I'm going to find just our cheekbones on either side here. And we're going to drop just down a little bit and push in just lightly, okay? And just like we did before when we were palpating the TMJ joint, we're just going to slowly open and close our mouth as wide as we can as we're pushing in. Good. One more. Awesome. So what you probably would have felt as you're pushing in is the muscle is going to push back out at you. So as you just slowly push in different areas of that muscle pushing out, it's going to give it just a little gentle massage. All right. And then the second spot that I really like to go to for my patients is right up in the temples. So you just want to give like a nice temple massage, just nice circles. And while you're doing that, just open and close the mouth real slowly. Awesome. So as we're massaging the muscles around, we're just trying to relax them, loosen them up, and make sure that they're functioning properly so that we can decrease the pain into the jaw joint. All right, so that is my presentation. Gone through all the components of it, what we want to look for, what we do in clinic, and then kind of some of the things that I send home. So if we have any questions, Jill, maybe you can call them out to me. Did we get any?
Yeah, I'll give you a minute.
Yeah, we'll give it a minute. So I actually, while we're waiting, I actually did notice that there was a question on the Instagram page. So I'm gonna kind of try and remember it off the top of my head. Someone posted online that they were having some TMJ pain, some jaw pain, but it only seemed to crop up when they were consuming alcohol. So they were wondering what that was about. So I thought I'd answer that while we're here. So a few things about that. The first one is it's a drug-induced pain. You're consuming a drug and it's causing you some pain, which is kind of an issue, right? So I don't suspect that any of the treatments that we offer are going to make you immune to alcohol. And if you're consuming it for more than just its taste, you probably don't want to be immune to it anyways. But yeah, so in terms of alcohol, if it's drug induced and it's causing you some pain in there, that's the treatment isn't necessarily going to fix that or cure you of it. But the actual treatments we send you home with may be able to help bring the pain levels down a little bit as you experience it. So some of those massaging techniques that we've gone over today might be beneficial. They might be helpful. The other thing that may be going on, and it would depend on what kind of alcohol that you're drinking. Anytime you drink anything sour is going to set off those salivary glands. You have this response you have no control over. It's just a complete reflex where the salivary glands contract, all the muscles contract, they release all their saliva in order for you to deal with the sourness in your mouth. So if you're drinking some sort of sour beer or something like that, it can cause some of those muscles to contract, which may be causing you some of the pain. So that just may be, if it's the kind of alcohol, you may have to switch that up in order to mitigate some of the pain in that case. Yeah. Any other questions?
I don't have any questions. Oh, Alan, love that thought. Thanks, Sue, for reaching out. I'm not sure if you can see this or not, Dan, can you?
Yeah, so I'll read it out. So Sue Edwards has said, I had an MRI and it showed I had a dislocation, I assume, of the TMJ. Because of this, I was not sure if I could do the exercises on it or if it would aggravate it more. Okay. So if you've had an actual dislocation of the jaw, there's probably quite a bit of damage that may have happened in there. So definitely you'd want to consult with either Dr. Jill or myself before you do some of these exercises yourself at home, just to make sure that they're safe to do. I suspect that they will be, but again, you just want to get checked out to make sure that there's no pain. So we do a basic exam of you, just check out your motions, how far you can open and close your mouth, what causes pain, and then we'd be able to prescribe you stretches, massages, exercises. And we'd probably target, so if you were having some serious issues after the dislocation, we try to target our treatment so that it focused on making sure that you could do them without too much excruciating pain, and of course, without doing more damage. I hope that answers the question. I wasn't sure if I was reading it right. Awesome. You're welcome. Do you recommend a night guard for those grinding or clenching at nighttime, or does it cause more pain / problems in the long term? Okay, that's a great question. So there's two ways I'm going to answer this. The first one is, as with every single treatment known to man out there, it's all individual patient dependent. So what works for some people just does not work for others. So it's going to be a matter of trial and error. However, when it comes to night guards, we're actually going into the mouth for those. So when it comes to that, I'll typically co-manage with a dentist or dental hygienist and allow them to make that official decision, because I'm not sure if it's outside of my scope, but it's definitely not within the realm of what I typically treat. So I don't offer night guards personally, but I definitely have recommended that people go seek those out and at least have that conversation with their dentist. Good question, though. All right. Any more? I'm kind of jumping back and forth between the chat. Great presentation. So we got another question. Is dry needling the same as acupuncture? Good question. Okay, so they are somewhat used interchangeably. From my understanding, acupuncture is typically applying a needle, an acupuncture needle, and leaving it for a little while, and that's how I use it. The individuals that I know that dry needle typically take a needle and they'll put it in, and they'll actually pull it in and pull it out in kind of this pecking motion. I'm going to be honest, I'm not exactly sure what the benefit of that is, but that's definitely not the type of acupuncture that I use. I just insert the needles, dry needles and leave it. And anytime we're working into the jaw, I'm not going to be using any electricity, any electroacupuncture. It's just straight acupuncture needles. Wait for 10 minutes and then pull them out. Okay, any more questions? All right. Well, if there's no more questions, thank you guys so much for joining us on this Monday night. I hope you guys learned a lot. If you have any further questions, we are always available and always happy to chat and go through more stuff with you. And one thing I'll add at the end here too, one of the things we offer in clinic, if you're ever not sure if we can treat or help with something, we offer free consults. They're 15 minutes. We'll ask you all sorts of questions just to get the gist of what's going on. And then we can either say, yeah, we're happy to help and we've got an idea of what to do, or no, we prefer to send you to someone else. And typically in that moment, we'll tell you who to go to. So if you're ever not sure, give us a call, book in for a 15-minute consult. We're happy to go through and help you with whatever you like. Botox. What are your insights on Botox for TMJ disorder? Okay. So for this one, I have to be very careful on how I answer because Botox is considered a medication, which is definitely outside of my scope of practice. So what that means is if I give any information on this, it's not considered medical advice. It's just my own opinion. However, I have spoken to quite a few patients who have gotten Botox injections. And just like I said for the night guard, it's very patient dependent. Some people respond very well to the Botox and some people just don't. What I've also found is it depends on how the injection goes sometimes. So I've had one patient where they've got Botox and it didn't work for them. And then they went back a little while later and tried it again and it worked well. So in that regard, I'm sorry, there's just not a great answer. It really is patient dependent, but there is some research to say, from what I understand, that it definitely can help. All great questions. Awesome. And again, that was not medical advice. That was my own opinion. Got to be clear about that. Okay. All right. Well, it doesn't look like there's more questions, but again, thank you guys for coming. If you have any further questions, you can call the clinic anytime, book in, and we're happy to have a longer discussion with you guys.
To offer online booking, you can find us at forthecare.com. Dan said, if you have any future questions, our ladies at the front desk are always happy to answer questions if you want to give us a call.
Wonderful. All right. Hopefully to see some of you guys around the clinic. Definitely you, Jill.
Definitely.
All right. Have a good night, everyone.